How does budesonide work in the body? Have you ever wondered how certain medications can help manage conditions like inflammatory bowel disease? Budesonide is one such medication that plays a significant role in this area. Let's break down how it works in the body, particularly for those dealing with inflammatory bowel disease and related issues. Budesonide is a corticosteroid medication that primarily acts as an anti-inflammatory agent. Its main purpose is to reduce inflammation in specific areas, especially in the gastrointestinal tract. This makes it particularly useful for conditions like colitis and sensitive stomach issues tied to irritable bowel syndrome. At the cellular level, budesonide binds to glucocorticoid receptors inside cells. This binding triggers changes that lead to a decrease in the production of inflammatory proteins. It also promotes the production of proteins that help reduce inflammation. One of the key actions of budesonide is to decrease the movement of inflammatory cells, such as leukocytes, to the affected areas. Additionally, budesonide suppresses the releases of substances that contribute to inflammation and tissue damage. It inhibits certain enzymes, which leads to a reduced formation of inflammatory molecules. This process helps lower swelling, redness, and immune system activity in the gut lining. As a result, it can help control symptoms like pain, diarrhea, and bleeding that are often associated with colitis and other inflammatory bowel conditions. What sets budesonide apart is that it is considered a second-generation steroid. This means it is designed to act mostly in the intestines, with minimal absorption into the bloodstream. This feature is particularly beneficial for individuals with sensitive stomachs, as it reduces the risk of systemic side effects that are common with traditional steroids. In practical terms, budesonide provides targeted relief by calming inflammation without causing broader immune suppression or hormonal side effects. It is often used to induce remission in mild to moderate cases of inflammatory bowel conditions. In some cases, it can be used at low doses to maintain remission, especially for microscopic colitis. Because budesonide acts locally and has a favorable safety profile, there is generally no need for dose tapering after treatment. This helps reduce the risk of withdrawal symptoms that some patients may experience with other steroids. In summary, budesonide works by controlling inflammation directly in the gut tissue. It activates glucocorticoid receptors, leading to decreased immune cell activity and reduced production of inflammatory mediators. This mechanism helps manage symptoms and promotes healing for those dealing with sensitive stomachs and colitis.